We are support for NICU caregivers, and we are Taylor, Macy, Angelina, and Hannah. So, good morning, everyone on the Grant Funding Committee, and thank you so much for your time and willingness to listen to our proposal for our program, Support for NICU Caregivers. Our mission statement is to support caregivers of children in the neonatal intensive care unit by providing tools and resources that they can use to positively support their mental, financial, and spiritual needs. Our vision statement is to promote increased quality of life amongst caregivers of children in the NICU by providing trusted, evidence-based resources and guidance from each member of the NICU healthcare team. So a little bit about our program. We provide weekly educational-based sessions and optional support groups to caregivers within the NICU. Our programs will provide weekly speakers on a rotating basis. We will also provide caregivers with information from each discipline within the hospital. And what makes our program so unique is that there currently are no educational-based support groups for caregivers currently.
So a little bit about our statement of needs. Our target population is parents and caregivers of infants in the neonatal intensive care unit, or the NICU, with low socioeconomic status, or SES. And these individuals struggle to have access to proper health care, education, daily occupations, and even basic community amenities. From this lack of access, individuals of lower SES are more likely to suffer from poorer health and have fewer resources to buffer against negative effects of poor health. Since low-income families make up a large portion of the babies being admitted to the NICU, providing them with the necessary tools to increase confidence, enroll participation, mitigate barriers to the infant's care after discharge, and obtain the information on how to access adequate health care can significantly improve patient outcomes. So now we have the health problem, and these are some of our barriers that we wanted to address with our population. Most are transportation disadvantaged, so they're not having access to a personal or shared vehicle. They can live so far away from healthcare resources that the distance makes accessing them difficult or impossible. And most important, whenever they have transportation disadvantage, they cannot make scheduled appointments or even visit a pharmacy to refill a prescription. Another barrier is language. So this is a huge potential delay in being able to even access healthcare needs, and can bar parent caregivers from interacting with the system as a whole. Another is parent caregiver education. So this lack of communication between healthcare providers and parents regarding their neonates' individual needs, as well as gaps in knowledge pertaining to particular health concerns of the infant. Finances is another one of our barriers. They have less comprehensive health insurance coverage. Most are Medicaid recipients. They have lots of burdens of out-of-pocket costs associated with health services. Some are even lack of employment. There's childcare costs and even basic amenities for the home that they struggle to finance. And lastly, we have mental health. And we found that in a sample of 150 low-income parents of infants who have been discharged from the NICU, more than 1/3 of the individuals screened positively for depression and post-traumatic stress disorder.
Now we're going to move on to our program description. So the impact that our program is going to have on occupational balance and wellness is by targeting 3 key areas of occupational balance and wellness to enhance the well-being of caregivers of infants in the NICU. So we kind of chunked them into 3 groups that we're going to focus on. So the first group of activities are going to focus on spiritual, social, and emotional wellness. That'll be support groups and mental health initiatives. Our second area is going to be focusing on occupational and intellectual wellness by giving caregivers education and training resources. And then the third area we're going to focus on is financial wellness. So the long-term goals of support for NICU caregivers, we have a goal to address each of those areas that we mentioned in the slide previous, but essentially our first goal, it's going to address spiritual, social, and emotional wellness. And in 6 months, 60% of low-income caregivers of NICU infants that participated in support for NICU caregivers will report an increase in their mental health on a post-survey given on their infant's discharge day. To address occupational and intellectual wellness, our goal is going to be in 6 months, 75% of low-income caregivers of NICU infants will report increased feelings of self-efficacy related to the care of their infant on a post survey given on their infant's discharge day. And then our goal to address financial wellness is going to be in 6 months, 50% of low income caregivers of NICU infants will report having benefited from the financial resources provided through our program on a post survey given on their infant's discharge day. Our plans to address each of these long-term goals. So to address our goal for spiritual, social, and emotional wellness, we will have weekly support groups. We will create education materials about coping mechanisms and mental health resources. We're going to create a social media page for the program, and that will be an area where these low-income caregivers can connect. It'll be a space for sharing resources, low-cost reused equipment, encouragement, and things that helped these other families get through their time in the NICU. So that's going to be that first area of occupational wellness. Our second goal, we're going to address that by creating in-room materials to track caregiver participation, having some sort of visual just to cue our healthcare providers and our caregivers to participate in this care and to start learning about their infants' needs. We're going to create resources and host trainings for caregivers to increase their self-efficacy, to make them more confident in jumping into a care with a healthcare provider. And then we're going to host guest speakers from the different disciplines in the NICU healthcare team so they can learn about all the different areas of health care that their infant's going to be receiving care from. And then we're going to encourage our healthcare providers to include these caregivers in their care, just to build their confidence and make them a little bit more confident when their infant gets out of the NICU and they go home. And this last area that we are going to achieve financial wellness. We're going to create pamphlets containing financial resources, such as government's nonprofit funded programs, and then also create that social media page. So having a space for sharing resources of where they found something on sale or low cost reused equipment because their infant grew out of it. So it's going to be an area that they can really help each other financially as well. Okay, so the logistics of our program, how it's going to work. Our participant recruitment is going to be through healthcare provider recommendation. These providers are going to recommend these families to our program, and we are going to go from there. And then also personal inquiry through our marketing materials or word of mouth. So if they heard something from another caregiver, they can reach out to us directly. The location and space. Our program will take place at Texas Children's Hospital and the Medical Center. We'll have a physical and a virtual space. So our physical space will be in the Texas Children's Conference Room, but we'll also try to stream all of our calls and workshops and trainings other than support groups through a Zoom call. And those support groups, we're not going to put those on Zoom just in case anyone doesn't really want their information on the internet. We'll give them an option, but if someone requests, we can maybe do that. And then establishing partnerships, Texas Children's Hospital and the healthcare providers in the NICU are going to be our primary partnership. Staffing and personnel. So our programs management is, or programs kind of day-to-day. It's only going to take one full-time and one part-time staff member. It's going to be managed primarily by our full-time staff member, with our full-time staff member delegating tasks to our part-time staff member. Our supplies and equipment, we will have a printer and printer paper for weekly handouts and caregiver education, laptops for our 2 program staff members, access to the conference room at Texas Children's Hospital with tables and chairs, and then a Zoom professional account.
For the evaluation and sustainability plan, first for the evaluation, the type of evaluation that will be used is the PEASY Holistic Wellness Assessment. For this evaluation, it's beneficial to all key stakeholders, including the NICU healthcare professionals, caregivers, therapists, and the NICU babies. This assessment is beneficial as it addresses the questions for the healthcare team as a whole and not just occupational therapy. It provides opportunity for intercollaboration when working with other disciplines to best serve the client moving forward in the program. This evaluation is easy, low cost, low risk, and time efficient. In order to collect the data, caregivers and parents will be given a handout where they answer a series of questions, and they're ranked from 1 to 10. They just circle from greatest to least. And then there's 4 open-ended questions that they fill out. There's 8 sections, and each of those contain those questions with an emphasis on self-perceptions of health and strategies for self-responsibility. Furthermore, it meets the participants where they're at with their current needs.
The same PHWA will be administered at the end of the program as well to compare growth in self-perception. And then for the sustainability plan, the sustainability of this program is achievable because it benefits multiple stakeholders involved, which will provide exceptional support to keep the program running. This is because the evaluation does not take excessive amounts of time and can be provided to NICU caregivers and parents at their convenience. Considering a lot of parents don't have very much time, that's taking into account those stakeholders. And then furthermore, mental health and anxiety are not a problem with a solution. It's a journey to be experienced individually by those caregivers and be processed, and a process to learn to cope with during a transition into a new role as a parent or caregiver.
So now I'm going to talk a little bit about the theory of occupational adaptation, or OA. So we kind of viewed our program through this OA lens. So to the right on the slide, you'll see a visual that's taken from the original article for OA. And I'll kind of go through the different pieces, but the main pieces are the person, the occupational challenge, and the environment. So the person, as we have mentioned before, are the caregivers of NICU infants, and their desire for mastery is to fulfill the role as a caregiver while they're in the NICU. And the environment is the NICU, and the demand for mastery from the environment is the external stressors resulting from the NICU environment. And this comes in the form of the occupational challenge. And the press for mastery is the need to provide physical care financially and to make critical decisions for the NICU infants. Furthermore, providing the NICU infant with resilience and involvement in the NICU infant's care. So the occupational role expectations from this population is from society and self, and the occupational response is the NICU caregiver's response to the occupational challenge. So you can kind of see each part, how they relate to each other and how it kind of flows and then continues as it goes along, and then it starts all over again. These are our references that we use. We thank you so much for listening to our proposal, and we look forward to hearing what you have to say about our proposal. Thank you.